Hi, this is Dr. Mario Mancini, the Medical Director of the Center for Integrative Care here in San Diego. And yes, that's me taking a kick to the head. This fight was in the World Tournament in which I was honored to fight for the U.S. team. Now, although I threw my opponent and went on to win the match, it came with a price. In fact, every fighter knows that no matter how good you are, you're gonna get hit. So I want to speak from first-hand experience that continuous impacts to the head can have the most devastating effect on one's quality of life. Now, I felt very fortunate to step out of the fighting circuit when I did because I knew I was going down a road heading toward a cliff. So today, I want to speak about a topic that is close to my heart, and that is traumatic brain injuries and concussions. Being a competitive athlete in full contact martial arts for years, I've had the first-hand experience of impacts to the head. Not something to brag about, but it's part of the sport. In my years of fighting in the ring, I did begin to notice some subtle symptoms that began to increase from these hits. Most noticeable were headaches, my ability to focus, retrieve words, and jumbling of words. It got to a point that I knew I needed to stop because I was moving in a direction headed for danger, no pun intended. So I began to study the impact of traumatic brain injuries and concussions and realized that the earlier impacts to the head had the potential to speed up a neurodegenerative process leading to a faster brain decline. I then began to research different strategies to not only halt the decline, but more importantly, improve brain function. Now, for years, I adhered to a strict daily ritual of dietary, herbal, nutritional therapy, meditation, tai chi, qigong, and other exercises, as well as acupuncture to support brain and body health and performance. Utilizing these therapies have made a significant impact on my overall health and well-being, which includes, of course, brain health and performance. Now, as with any high performer, we're always looking for ways to further improve our health and performance. So in my research to achieve this outcome, I came to a clear conclusion. That conclusion is that the quality of my life is in direct proportion to the quality of my brain health and performance. So you can have the strongest body and physical health, but if you have brain decline, your ability to enjoy and appreciate life significantly declines. I was asked recently, of all the most severe diseases, what would be the one that would be on top of my list? Well, I thought about all the physical diseases of the body. It would be pretty bad to have, but it was clearly a brain disease, such as Alzheimer's and Parkinson's, that would be most devastating. To lose the ability to experience life and remember the good times would be by far the most devastating, not only for me, but for the people that I love. This concern was not only for myself, but also for my family, friends, and patients. So I continue to research on what else could I do to not only minimize brain decline, but for my history of head trauma, but more importantly, improve brain health and performance. In my research, I came across a brain technology that has shown the most promise for not only brain health following trauma from the brain, but more importantly, brain performance. This modality is called Neurofeedback. This therapy is a research-proven way to improve your brain function through intensive brain training exercises. The process is simple, painless, and non-invasive. The base of this therapy is that you can learn how to alter your brain activity the same way you learn every other skill, through feedback and practice. How neurofeedback is different than any other type of brain exercise is that it provides instantaneous information about changes in your brain's electrical activity. See, with this technology, every half second you get a signal and reward when you meet the goal, and no signal or reward when you don't. It's pretty simple. In 20 neurofeedback sessions with feedback every half second, you get 72,000 chances to learn. That's a lot of repetition and practice. Brain science is now showing that repetitive exercises of brain networks reshapes the brain, also known as neuroplasticity. What's so exciting is that neurofeedback allows you to reshape networks in your brain after a traumatic brain injury. Now, prior to beginning my personal neurofeedback training, I had what is called a QEG Brain Map, which is a way to measure activity in your brain. The EEG, or electroencephalogram, shows this activity occurring instantaneously within a few thousandths of a second after it occurs in the brain. It can show areas of the brain where there is too little or too much activity. It can also show when timing is off in the brain between one area and another. Through the QEG, we are often able to see the reason for your struggles. And once we can see it, we can target it for change by using neurofeedback. In addition to a QEG Brain Map, I also went through a computerized brain performance test before beginning my brain training. Following the test, I thought I did pretty well. It tested variables of brain performance such as sustained attention, inattention, impulsivity, reaction time, consistency of my responses, and accuracy. In fact, results showed that I did do pretty good. I then thought, can the training actually improve my scores even more? Well, interestingly enough, after only 20 sessions of neurofeedback, they showed further improvement. I was blown away. Since then, I've continued to do neurofeedback to see what's possible, and scores continue to improve, but more importantly, how it's improved the quality of my life has been dramatic. In addition to neurofeedback, I also assessed my brain health and performance through a nutritional assessment as well as blood tests. This allowed me to incorporate targeted brain nutrition as well as exercises that support and improve brain performance. This integrative approach has not only helped me but also patients to receive the most complete approach to improving brain health. These are all the same strategies I use for my patients, which amplify the effects of neurofeedback. So if you or a loved one had a prior history of head trauma or is showing declines in memory, learning, attention, or anxiety or depression, contact the center to find out more about how we can provide you some hope through our brain health and performance programs. In closing, I just want to say that I feel so blessed with the opportunity to not only improve the quality of my life, but also the lives of my family, friends, and patients through neurofeedback brain training. I'm Dr. Mario Mancini, and I wish you the best.